Awesome. Thank you so much, Amy, for that introduction. I am so excited to speak with you all today about CBT strategies for youth. I am Dr. Sarah Love. I am a pediatric psychologist for our headache program at Akron Children's, and I'm so excited to get a chance to talk more about some tools that can be really helpful for managing headaches and pain. So, Amy, if you want to go to that next slide, that'd be great. My goals for today's presentation are to give an overview of the biopsychosocial model of headaches and talk about pain psychology. I think sometimes it can be a little bit confusing when a psychologist is a part of that headache management team. And so I really want to spend a little bit of time talking about why psychology can be so helpful when it comes to navigating the headaches and pain. My goal is also to talk about some of the key strategies that you might learn as a part of cognitive behavioral therapy. So giving sort of an overview of what that treatment might look like. My goal is also to give a demonstration of some of the CBT strategies, to do a little bit of a deeper dive into some of those techniques so that perhaps you even walk away today with some skills and some tools that you might think about incorporating to help manage the headaches and pain. And then lastly, I want to kind of spend some time going over a couple of helpful apps and resources, and also talk about ways that you might find providers that kind of specialize in this treatment. So we can go ahead to the next one. So oftentimes as a psychologist for our headache program, I might have patients and families be a little bit surprised that a psychologist is a part of that headache treatment team. And I think it's important to kind of explain why that is and what psychology can be helpful when it comes to pain. So I wanted to kind of talk about why non-medicine based strategies can really be helpful. When we think of headaches, we often kind of think of the biological piece, or we have a little bit more familiarity with that. We might have heard that headaches can be genetic and run in families. We might have heard before that things like hormones can impact our headaches, having allergies, having a head injury or concussion, recovering from a viral illness. We also know that neurochemical changes in the brain can result and trigger headache and migraine. So we tend to kind of sometimes think about headaches and migraine as just sort of being caused by some of those biological factors. And we treat those typically by working with a physician, a pediatrician, a neurologist, and address that often with medication. But we also know that there's other factors too that can make a really big difference in how our headaches present and how frequent they are and how intense they are. We don't want to forget about those factors, and we don't want to neglect those factors. We want to really make sure that we're addressing those pieces too. So when we think about the psychological and social factors, these can be things like having high stress levels, having symptoms of anxiety or depression that can worsen the presentation of pain, having a really busy schedule, maybe being in multiple AP classes, having really intense, busy schedules and exams, and putting a lot of that academic pressure on. Having maybe not the most active coping style. Sometimes folks who tend to have what we call more passive coping. This can be more avoiding things because we're worried it might trigger that headache or migraine. This could be struggles with going to school or functioning because of the headache or migraine. All these factors can sort of worsen that headache presentation. We also know that social factors impact our headaches too. Kids and teens don't just exist in a vacuum, right? They interact with a lot of different systems. Things like school and how supportive that school is, that school environment, how understanding the school is of your child's headache or migraine. Maybe they have teachers that make comments sometimes that can be frustrating to them, or have folks that might bully them for having headache or other reasons, having challenges with some of their friendships at school or outside of school. There being a lot of family transitions and adjustments and conflict. We also might see that how parents and caregivers respond when a child or teen is in pain can sometimes help or sort of hinder progress at times. So for example, let's say we have a teen who every time they have a headache or migraine, they are in bed all day, they miss school, they don't do chores, kind of all their responsibilities go away. At first, that might feel good, but over time, that may not be the most helpful response to really help that child or teen learn to cope with those headaches or migraine and promote that functioning. So we want to make sure that when we're addressing headaches, we're not just addressing the biological piece, we also want to address the psychological and the social factors too, so that we comprehensively treat the headaches. We can go ahead to the next one. Pain psychology is really a specialized area where psychologists learn and teach folks how that pain is experienced and really share what are things that can impact pain, make pain better, make pain worse. Pain psychologists often also teach skills and tools to kids and teens to help them navigate and manage that pain. So, working with a psychologist for your pain, for your headaches, does not at all imply that the pain is in your head or that the pain is a psychological problem, which I know sometimes that messaging can exist and can be really stigmatizing and frustrating. So I want to assure folks that what this means is that you're working with someone who's helping you to understand that pain and learn tools that can make that pain better and help you cope with it. Something that I often spend a good amount of time doing when I'm working with kids and teens is helping them understand what are things that can impact pain, make it better or worse. We know that pain is complicated, and there are many different parts of the brain that help us notice and experience and feel that headache pain. A couple parts of the brain that are involved in us noticing and experiencing headache pain are also involved in things like helping us pay attention to things, helping us experience and have different emotions, helping us have thoughts or think about things. And because those parts of the brain also help us notice and experience pain, that means that things like attention or distraction from pain, certain emotions that we have with our pain, and certain thoughts that we have can either make our pain better or worse. So thinking about, maybe some of you here have experienced migraine. Thinking about if you were to be having a migraine right now and you were really focusing on it, really thinking about it, and you were really frustrated by it, and maybe you were having thoughts like, why am I having another migraine today? Those can be things that might intensify that pain. Versus if we learn, how can we distract away from the pain, take that attention off of it? How can we really start to relax and calm down our body and have more positive emotions? And how can we have more helpful thoughts? Things like, I'm going to get through this headache. I'm going to use some of my skills. And when we start to kind of shift those things, that can really be helpful in managing the headaches and the pain. I also spend a lot of time explaining how stress and headache pain relate to one another. I often talk a lot with my patients and say, I want you to think of like stress and headache pain as being these two best friends that just do everything together all the time. And what I really mean by this is that when we are having a headache, we're having that high pain, we're having a migraine, that is so stressful to our bodies. Our bodies really don't like to have pain, just like you don't like to have pain. So every time that pain goes up, that's increasing our body's stress levels. And then we also have day-to-day stress, right? School stuff and tests and sports and games and other things that day-to-day further increase that stress. And as that stress goes up and up, that headache pain tends to go up too. So what we want to do is we want to break that cycle. We want to learn ways to lower that stress in the body that can then help bring that pain down. So we talk a lot about that relationship and how we can kind of work with that and learn tools to really lower that stress to help the headache pain too. You can go to the next slide here. Pain psychologists or other mental health providers that have that training, they may use cognitive behavioral therapy for headaches and pain as an evidence-based treatment modality to really help teach those skills and strategies that can help when it comes to learning those tools to help the headaches and pain. Cognitive behavioral therapy is a well-studied, well-researched therapeutic intervention. It has strong support for a variety of mental health concerns, especially things like anxiety and depression, but it also has very strong support for helping folks to deal with headaches and pain. Cognitive behavioral therapy is all about this idea that how we think is strongly connected to how we feel, which is strongly connected to how our body reacts and responds. We know emotions really live in our body and show up very physically, and is connected to how we behave or how we cope. So thinking about someone who is dealing with headache or migraine, especially dealing with it a lot, it is so hard to deal with. It impacts so many things. They're typically going to have some pretty negative thoughts about these headaches and migraine. It would be strange if they didn't. So if someone's having headache and migraine often, they might have thoughts like, these headaches are never going to go away. They're never going to get better and nothing's going to help. And if we're having a lot of those negative thoughts, we're going to feel some really negative emotions. We might feel sad, frustrated, stressed. We know that a lot of those negative emotions can then intensify our pain. So our body reacts and responds. We might have higher headache pain. We might also feel like our muscles are more tense. We might feel like our body's more heavy with those negative emotions. And if we're having negative thoughts, negative emotions, and our body's responding with more pain and not feeling good, it's certainly going to impact what we do, how we cope in our behavior. So we may be more inclined to miss school. We might isolate from friends more. We might miss our sports. We might really struggle with that day-to-day functioning. So what cognitive behavioral therapy is designed to do is to really look at each of these pieces here, how we think, how we feel, how our body reacts and responds, and how we behave, and learn different skills that target each of those areas so that we can really change this cycle. So let's say someone were to go through cognitive behavioral therapy or CBT. They may learn how to change some of their thoughts. They may have some thoughts more about their headaches now of, I can handle this. I'm just going to do my best today. I'm going to take it day by day, moment by moment. That's going to help their emotions to feel a little bit better, lower a little bit of that stress. That's going to help that pain. And that's going to help them feel more inclined to kind of use some of their coping skills that they've learned and to try a little bit to function if they can. So our goal is to kind of target each of those areas and really change that cycle and what it looks like. So we can go to the next slide. There is a really strong research support for cognitive behavioral therapy for headaches and pain. And I always just like to highlight that so that folks know that this is a well-studied, well-researched treatment that can be really helpful. When we look at the research, it shows us that participating in cognitive behavioral therapy for headaches and pain can make a big difference when it comes to reports of headache pain, headache severity, and what we think of as functional disability or how those headaches impact day-to-day functioning. It can also impact in a really positive way quality of life. Some studies have also looked at when we combine cognitive behavioral therapy with common medications that might be prescribed. So for example, a really well-documented study looked at amitriptyline medication plus cognitive behavioral therapy and found that when it was combined with the CBT, it offered added benefit for folks. Because of the strong research support, it has now been really recommended in American Headache Society, American Academy of Neurology guidelines that this be something that's really discussed up front and really considered a key treatment protocol that we mentioned for folks dealing with migraine to really help them get the best treatment and support. And we can go to the next one. So I wanted to kind of give just a little overview of what you might encounter, some typical component strategies that you might learn or that might be a part of CBT if you're working with a provider for this therapy. If you do get connected to a psychologist or mental health professional that does cognitive behavioral therapy for headaches and pain, you'll often find that it's a very structured treatment. So this is not kind of that conventional talk therapy, tell me about your day. This is really, let's dive into our skills, our tools. It's structured, and it's often more brief and targeted. So you might see someone for 5 to 10 sessions, more in that abbreviated nature to really focus on getting those goals and meeting those improvements. Oftentimes with cognitive behavioral therapy, there are sort of set components of it. So one that's often included is pain psychoeducation. A little bit of what I was doing earlier, kind of explaining a little bit about what impacts pain, why we can be able to use skills that can help our pain, talking about that mind-body connection, how stress can impact our headaches and pain, and helping us understand a little bit more about the brain and pain, really laying down that foundation. Once we've really kind of talked about like why these tools can be helpful, you'll often learn what we think of as relaxation strategies. So if we think back to a few slides ago, where we had that diagram with the thoughts, the emotions, the body responses, these relaxation strategies are really going to help target our emotions and how we feel, as well as how our body's reacting and responding. So we're teaching relaxation tools that are designed to really lower that stress response in the body, which can have a huge benefit for headaches and pain. These 3 skills listed here, I'm actually going to talk a lot more in depth in a few slides, and we'll even kind of demonstrate a little bit how to use these so that maybe you even take something with you today that you can use. Behavioral strategies, these target the behaviors, really how we cope, how we respond to pain, and how we work to improve functioning with headaches. Some key behavioral strategies that you might learn or that might be a part of treatment can include things like behavioral activation. This is really working with your provider to think about how these headaches and migraine have impacted your life and maybe things that you've stopped doing because of them and starting to slowly get back into them. So you might work with your provider to schedule small, kind of gradual activities, things that maybe you haven't been doing anymore that can boost your mood and help distract from the pain. So let's say I'm working with a teen that usually always loved to crochet, for example. We might think about, okay, we haven't been crocheting lately with these headaches. How can we do that and get that on the schedule, set aside some time for it? We're going to do it Monday at 4 p.m. and really kind of get specific with it. Maybe they haven't been able to see their friends in a while. Okay, what do we want to do? Do we want to start by texting a friend? Do we want to start by maybe scheduling a time to go see your friend outside of school? Really kind of gradually get back into activities. We're also going to talk today, a few slides from now, do a little bit of a deeper dive into what's called activity pacing. So I'll explain that in a little bit, but it's really a way to help improve that functioning. And then we also often incorporate as a part of treatment reinforcement and behavior plans. So oftentimes when I'm working with kids and teens with migraine and headache, it is really hard to function. It's hard to get to school. It's hard to get to activities. So we want to think about, if that has been really challenging, can we come up with rewards and reinforcements to really say, hey, I understand that it is extremely hard, right, to get out of bed and go to school when you have a migraine. But let's think about coming up with a reinforcement system where for every day you attend school, let's say you get a point, and at the end of the week, you can exchange your points for a larger reward. Or maybe we look at daily rewards, smaller things that you can earn each day for something like school attendance. So if there are certain things that we want to work to promote in terms of functioning, we can use behavior plans to help do that and to make sure that we're recognizing how hard that is, and we want to reward that. We can go to the next slide. We also talk a lot about cognitive or thinking strategies, since our thoughts are so important when it comes to this type of treatment because they impact our feelings so much. We want to really work to recognize what our thoughts are, if they're helpful or not helpful, how they're impacting our headaches and our pain, and really learn if our thoughts aren't very helpful, how we can challenge them and change them. We may also work together to develop specific coping thoughts, things that a child or teen can tell themselves in the moment when they're dealing with a tough headache or migraine to help them cope. And we'll talk about those in a little bit more detail later. I also teach problem-solving skills. This really helps kids and teens learn how to be flexible when it comes to the headache and migraine and to navigate those tricky situations and problems that can sometimes come up from having headache and migraine as a child or adolescent. So we really work to come up with ways to brainstorm solutions to different problems that can come up and really get that control. Collaboration is often another core component of CBT. Your provider is going to often be helping you navigate the systems that your child or teen interacts with as a part of treatment. So let's say, for example, that attending school and staying in school is very challenging because of the headache or migraine. Your provider may give you ideas of school accommodations or talk to the school counselor with you or have a meeting to advocate for your child or teen. They may also come up with ideas for sports accommodations, for example, for some of our athletes who really want to still participate but may not be able to participate at that same level. And they often collaborate with your medical team. Within our headache program at Akron Children's, we are completely a multidisciplinary team. So we collaborate on patient care. My role, I really see as advocating for my patients and families and, relaying messages when I need to and communicating all together so that you get the most comprehensive care. So oftentimes that collaboration piece is really key. Another core component of CBT for headaches is often working on healthy habits and lifestyle factors. So there are a lot of different day-to-day habits that can make a big difference when it comes to headaches and pain. You may have heard these, when you talk to your neurology provider or your pediatrician, that it's so important to get good sleep at night, to make sure that we're getting some movement in throughout the week, that we are eating throughout the day. We're not skipping meals. I know skipping breakfast can be a big one sometimes for teens. And that we're staying hydrated, we're drinking enough water, we're navigating taking breaks with screens and not overdoing it. And so working with your provider, the goal is really to look at your habits and to set some small goals to make little tweaks to then help those headaches and pain. So really working on the lifestyle factors can be very, very helpful too. All right, so what I want us to kind of do next is do a little bit more of a deeper dive into some of the skills, do a little bit of demonstration. This way, you might even leave with some skills today or think about what you could use moving forward. So we can go to the next one. So one of the big relaxation skills that is often taught as a part of cognitive behavioral therapy for headaches and pain is a breathing technique called diaphragmatic breathing. So this is a lot different than how we typically breathe day to day. This is actually how we breathe when we're deeply relaxed and asleep. So we're not typically used to breathing in this way, but when we do this type of breath, it's very relaxing to our body, and it really helps lower that stress in the body. We can use this breathing technique on a daily basis to lower that stress every day, which can help with preventing some headache and migraine. But we can also use this almost like you would an acute treatment in the moment when you're having a headache or migraine to kind of ease that pain, take the edge off the pain, help you through that. So with diaphragmatic breathing, you might also hear this called belly breathing. Instead of our chest and shoulders moving when we're breathing, we're really keeping those still. And what we want to have happen is our belly to move in and out as we breathe. So I often tell my patients and families, I want you to kind of imagine that you have like this big balloon in your belly. And when you're taking that big, deep breath in, you want your belly to go out and expand, just like you're inflating that balloon. And then when you're exhaling, we're deflating the balloon. We're really bringing that belly back. So when you breathe in, belly's out and forward. When you exhale, it goes back in. Now, this is going to feel a little funky at first. You might have to really kind of think about it because we're not used to breathing in this way. But when we're first learning it, and if you want to even kind of try it out today, it can often be helpful to put one hand on your chest and then one hand on your belly. Now, that hand on your chest should stay nice and still. You shouldn't feel much movement here because we don't want that chest to be moving. That hand on your belly, you want to really focus your attention on that hand, and you want to kind of guide that belly hand out and in as you breathe. So you should feel that hand move in and out. I'll kind of demo for you here. I know I'm probably a little small, but I'll demo here. So what I'm doing is I have one hand on my chest, one hand on my belly. When I take that belly breath in, my belly goes out, and then when I exhale, belly goes back in. So hopefully you could kind of see that movement a little bit. That's what we're sort of aiming for, is to see that belly go in and out. Once you kind of feel like you got that movement down, then we want to make sure that it's really slow and controlled. A lot of folks will aim to take a breath in for the count of 4 and out for the count of 6. I'm going to show you guys at the end today a couple breathing apps that are breathing pacers. And all that means is they're kind of like these images on the screen that you'll look at, and they either get bigger or smaller, or they go up and down, and it tells you when to inhale and exhale so that you can kind of have that visual of how slow and controlled we want that breath to be. Diaphragmatic breathing is often one of the first relaxation tools that I'll teach folks because it's very portable. We have our breath with us everywhere we go. So I often tell kids and teens, this is a great one to do if, let's say, you're stuck in class dealing with a migraine, or maybe a part of your child or teen's action plan is to be able to lay in the nurse's office for a little bit. They could be doing their belly breathing throughout the school day to help them kind of navigate stress or navigate that headache pain. We can go to the next one. Another skill I wanted to just give a little bit of info on is called guided imagery meditation. So guided imagery meditation is a form of meditation where we're going to really visualize and think in our mind of peaceful, calming, relaxing things. Our brains are actually kind of bad at telling the difference between what we imagine and what's reality. We can kind of use this to our advantage because when we imagine something really vividly in our mind, it can really change how we feel, how our body reacts and responds. This is very relaxing, so good to kind of lower stress. And it's also very distracting. It can help take our minds off the pain, which can also be a good thing. One way that we can do imagery is to listen to recordings. I'll actually show you guys later the name of an app that has free 5-minute meditations. These recordings involve folks describing the peaceful place with a lot of detail, and you kind of sit back, relax, and listen to it. Another way that we can do imagery is we can do what's called taking a brain vacation. With this type of imagery, very easy to do, very easy to kind of teach your child or teen to do, is you want to think of a peaceful, soothing, calming place. And this could be maybe a place that you took a vacation to. Maybe it is a beach, a pool, a park you love to go to, your backyard, a room in your house, whatever kind of comes to mind for you as a peaceful, calming place. And what you want to do is really get that image in your mind of that place. It can be helpful to kind of have your child or teen close their eyes, really sit back and get that image in their mind. And while they have that image in their brain, we want them to think about what they could see if they're around that special place, what they would hear if they were there, what they would smell, taste, and feel. Let's say we were going to go on my little brain vacation here and go to the beach. That's my kind of calming, peaceful place I like to go to in my mind. What I would do is sit back and close my eyes. I would start to think about the beach in my mind. And I would think about, okay, what can I see around me at the beach? Maybe I can see the clear blue water, the white sand, the beautiful palm trees swaying in the wind. Maybe I can hear the waves crashing at the shore, or I hear some birds chirping. I can smell the salty water. I can smell some sunscreen. I can taste an amazing tropical smoothie that I'm drinking on the beach. And I can feel the warm sun and the sand and maybe even the cool water at my legs. So you kind of bring that image to life in your mind. And because our brains are so good at responding to what we imagine, it just kind of helps ease some of that stress and ease some of that pain. This is something that a lot of kids and teens like to do even sometimes before bed. Like, let's say their headache or migraine is making it really hard to fall asleep. This can be great to do in the evening. I have a lot of kids and teens who do this, especially if they do go to the nurse's office. After they take their rescue medicine, lay down for a little bit in the office, they might do some guided imagery in their mind, take that brain vacation. Might even be able to do this during study hall if you put your head down for a little bit and kind of go to your peaceful place. So this one can also be one that you can do, outside of home if you need to as well. We can go to the next one. Another tool that you might learn in cognitive behavioral therapy is called progressive muscle relaxation. This is another relaxation strategy. And this tool is really great for helping to lower muscle tension, helping to lower that stress and tension in the body, and can also be good, especially if your child or teen has a lot of tension headaches, notices that like muscle tension, especially in their face or neck or shoulders, can kind of lead to more tension and pain. This is a great tool that you can start to use. So with progressive muscle relaxation, you take different parts of your body and your goal is to tense and then relax the muscles. This is going to help you relax that tension, but also help you really recognize that difference between what a tense muscle feels like and what a relaxed muscle feels like. You might just do some parts of the body when you do this. You might do the whole body, kind of starting at the feet or the face and going through your entire body. But your goal is to take whatever part of the body that you start with, really tense that muscle as tight as you can, kind of hold it for about 5 seconds, and then slowly release that tension. It's really important that we're breathing slow and deep as we do this. If you want to kind of get like a little taste of it for yourself, I want you right now to kind of squeeze your toes like you're kind of grabbing sand with your toes. Really hold that. Hold it just a little bit longer here, just a little longer. And now slowly let your feet relax and really notice that difference between what that tense foot felt like and that relaxed foot. Now, if we were going to do the whole progressive muscle relaxation, we then would move to your legs, having you really tense those calf muscles, and then release and kind of slowly move up the body. Sometimes if someone doesn't have a lot of time to kind of go through their entire body, all those muscle groups, especially folks with headache and migraine, it can be helpful to focus on some of the face muscles and shoulder muscles, especially. So to really kind of tense and relax those muscles, what we might do is kind of bring our shoulders up really high towards our ears and then slowly relax them. We might have the child or teen completely scrunch up their face, hold it, and then relax it. We can raise our eyebrows really high, hold it, and relax it. So we can kind of target those muscles too that might hold a lot of tension that can impact headaches. What I like about this is there are a ton of amazing progressive muscle relaxation scripts and videos on YouTube that are just readily available. There's ones that are really designed well for younger kids, older kids, teens, and you just kind of pull one up and it sort of guides you through each of those different muscle groups so you can try that out. We can go to the next one. Another tool that's often a key part of CBT is activity pacing. This really targets the behaviors and the functioning piece. So with activity pacing, this is a skill that can help kids and teens to function, but in a very balanced way. What we tend to notice is when kids and teens are dealing with headaches and migraine often, they can sort of fall into what we call the boom and bust cycle. And what this can mean and look like is when, let's say, they're having a good headache or migraine day, maybe pain's really low or we don't have a headache or migraine at all, it's like, oh my gosh, this is amazing. I am going to do all the things. And then inadvertently, they might overdo it. They might go to school, do all their homework, see their friends, go to sports, and then they overdid it and they crash. And now the headache's a lot worse the next day. And now we need kind of a recovery day. We're staying home. We're missing out on things. We're getting behind. And then we got to try to get back to the boom again to get caught up. And so what we want to do is avoid either way overdoing it and pushing too hard when we have that headache or migraine, or way underdoing it and not doing anything, because then we get behind on things, that stress increases. We really have to play that catch-up game. So activity pacing helps us find that balance so that we're not way underdoing it or overdoing it. We're kind of finding that sweet spot. So we can go to the next slide. The way that I teach activity pacing is to just go through a couple steps that can help us really break down an activity so that we're going about it in a balanced way. We're not overdoing it. We're not pushing too hard, or we're not doing anything. So I want us to kind of think through an example here. And let's just pretend that, maybe I'm working with a teen who is experiencing like a 5 out of 10 headache on the pain scale. And they have this math packet that's due tomorrow. And it's really important that they get it done because it's a big part of their brain. One option could be, right, just plow through it all. But then they're probably not going to feel good. And that pain's probably going to be a lot worse. Other option would be not do it, which short term might feel good, but then maybe we get a bad grade and we get behind. So we want to think about how can we do this in a balanced way so that we're not way overdoing it and making that pain a lot worse, or not doing anything. So what we want to do is first think about what's the activity that we're going to pace out. So in this case, it's math homework. Then we want to ask ourselves, how long can I do this thing before I'm going to feel worse or my pain is going to get higher? So let's say that the teen with the 5 out of 10 headache feels like they could work on that math packet maybe 10 minutes. Great. Then what we want to do is create a schedule where we're alternating between working on the thing for that set amount of time that they feel like they can. And then we want to alternate that with short breaks. Now, these breaks, typically somewhere between 2 to 10 minutes is good to kind of give us a brain break, let us rest a little bit, lower pain, or do a skill. So what this would look like is maybe we work on the math homework for 10 minutes. Then we're going to maybe take a 5-minute break, kind of lay down or put our head down. We're going to go back to the math homework, do another 10 minutes of it. Then maybe now we're going to take like a 10-minute break. Stretch, have a snack, maybe do some diaphragmatic breathing. Then we're going to go back and work for 10. And we kind of keep repeating until we're done. But all these mini breaks, the goal is that either the pain kind of stays where it's at or might even go down. A lot of times I teach this and how to use it for like getting through the morning routine. So especially if your child or teen really struggles to get out of bed in the morning, get ready for school when that pain is really high, we can think about how we can pace out getting ready for the day, taking lots and lots of breaks to kind of increase the chance that they may make it to school that day. We can also think about pacing out chores at home that they might have to do, or maybe an activity with a friend or going for a walk with a friend. We can really just pace out anything. We just have to be mindful of our limits and really incorporating those breaks. We can go to the next slide. Another common piece that I wanted to talk about today in strategy is use of coping thoughts. This is really targeting making sure that we're having more helpful or neutral thoughts about the headaches, which I know can be really hard to do, especially when we're in high levels of pain. So what we want to do is we want to think about when maybe pain is lower or not as high, what might be some things that I want to be able to tell myself in the moment that are going to be encouraging, helpful, neutral, just help me kind of get through that tough pain. So you want to work together to come up with what are some coping thoughts. These could be things like, this hurts, but I can get through it. I've dealt with these bad headaches before and I've made it through. I'm doing my best and that's enough. I'm just going to see what I can do. This pain will pass. I can use my coping skills. So really coming up with these that they can use in those moments. And how we use our coping thoughts is when then we're dealing with that headache or pain and we're noticing that we're not feeling good, we're having a lot of negative thoughts about it. We want to say these coping thoughts either out loud or in our mind to help us to start to feel better and to have those encouraging thoughts. We can also, while we're saying our coping thoughts, be taking deep breaths, really trying to relax the body. Now, a lot of my teens, when we come up with our coping thoughts, they might put them in like a note in their phone. That way, they kind of have their phone everywhere they go. They can look at a note if they need to when that pain is high. Sometimes they'll write a few on Post-it notes, kind of put them by their bedside table or on their bathroom mirror. Younger kids, I often make coping cards with them. Take some note cards. We write our coping statements on them, and then they can kind of have their cards with them or even take them to school if they need to. So these techniques here, I just wanted to kind of give a little exposure here, kind of give you a little taste, and maybe you can even start to think about using some of these things. But what I really want to emphasize is with all these techniques that we kind of talked about today, it is so important that we use them and try them and practice them when pain is low or when we're having a good headache day, so that when pain is high and we're having a bad headache or migraine, we know how to use them, we know how they work. The last thing we'd want is to try diaphragmatic breathing for the first time during a 10 out of 10 migraine. It's not going to go well. So we want to practice when we're feeling a little bit better so that we can really get these skills and know how to use them. And then in those moments of high pain, they're going to benefit us a little bit more. We can go to the next slide. So with cognitive behavioral therapy for headaches, with it being a more specialized treatment, sometimes it can be helpful to think about how to find a provider. So if, after you're listening today, you're thinking, oh man, this might be something that could be helpful for my child or teen, how can I sort of find a provider? One recommendation that I have is to really look at wherever maybe you seek medical care, the hospital you go to, your pediatrician or your neurology provider, whoever you see primarily for your headache management, and ask them if they have someone who offers this treatment on their team or within their hospital, or if they know someone in the community that they might recommend. Thankfully, within our hospital, I'm a part of our headache program, so it's easy for patients and families to get connected, but it can vary in easiness in terms of finding a provider. If, let's say, you can't find someone, as a part of the hospital that you go to or who collaborates with your pediatrician or neurology provider, there's a nice search tool made by Psychology Today. If you go into Google, you type in Psychology Today, find a therapist database, that's going to bring up a search tool that's designed by Psychology Today. It allows you to put in your city, your zip code, and then it has a bunch of filters that you can click. So you could click that you want a provider who sees child and teens. Maybe you want a provider who does CBT, who has pain experience. Those are all kind of options in the filter, and then that'll bring up some local providers. Oftentimes you can then kind of look at their profiles, see if they offer this treatment, or even contact them through there to get connected. So it's a nice kind of resource as well. We can go to the next slide. I also wanted to share a really great resource for folks living in California. An organization called Streamline Health helps to connect you to specialized treatment services such as CBT for headaches and pain via telehealth. So you can work with a provider to go through these skills and strategies and go through this treatment and really work with someone specialized in that area. Now, right now, it's just for folks in California, but I did want to share this in case this applies for you and if this is something that would be good to kind of get you connected with providers who specialize in this area. You'll see on this slide a QR code that can connect you to the referral process. You can also reach out to info@streamlinehealth.com to help get connected as well. So just wanted to share another great resource. We can go
I would say too, Sarah, like anybody that, if they want to reach out to us too at Migraine at School, we have the information of these folks because these are people that we work with as well.
That's awesome. And then just a few apps and resources. These are things and apps that I'll sometimes use, in my own clinical practice with patients and families that I wanted to share. When I was talking earlier about belly breathing or diaphragmatic breathing, these two breathing apps listed, Breathe Plus and Breath Ball, are really nice breathing pacer apps. So they have an image on the screen that you can look at as you're breathing to help make sure your breathing is slow and controlled. There is also 5-Minute Escapes. It is a free guided imagery meditation app. It has several free 5-minute meditations that you can listen to help lower stress, kind of take your mind off the headache. Smiling Mind is another meditation app with some good guided imagery meditations, as well as some mindfulness meditations. Relax Melodies has calming music and calming nature sounds that you can listen to if, let's say, you're taking that brain vacation, imagining your special place. I also wanted to include in here, especially because it can be tough sometimes to find a provider or to access treatment, is a self-guided workbook designed for teens. Dr. Rachel Zoffness is a pediatric pain psychologist who created the Chronic Pain and Illness Workbook for Teens. You can get this on Amazon, and it basically has guided exercises and explanations and ways to practice the different CBT skills. So it's something that your teen can kind of work through to get more exposure to some of the techniques. And then, of course, Migraine at School, fantastic resource for much, much great information as well.